Hello, and welcome back to the Aging with Ability podcast. I'm Christine Gorsick. I'm a physical therapist and the owner of Aging with Ability. And today we're going to continue our discussion about 11 conditions that you may be surprised that physical therapists treat. And we talked about the first five in the last episode. Those included dizziness and COPD and heart failure. So if you missed that, go back and find it and check that out because that might be something that's applicable to you. So today we're going to finish up with the final six. So, the first one is diabetes, and a physical therapist can help with diabetes by educating patients on their disease, the implications of it as far as how it affects your, healing, energy level, your response to exercise, which can be really important. And again, working with monitoring vitals during and after exercise, blood sugar monitoring, and having a little bit more knowledge about what those numbers mean in relation to what you're being asked to do as part of your therapy. And again, just strengthening, that's a huge part of increasing the capacity and improving quality of life in someone with diabetes. And I will link to an article about physical therapy for diabetes. And the next one is falls prevention. So, of course, we get referrals tons and tons and tons of times after a fall, but the role of a physical therapist, can also be fall prevention, and that would definitely be preferred. So, when if you're experiencing some new weakness or you've been kind of noticing some tripping or close calls, you leaned against a wall, things like that, or you're starting to use that cane, you pulled it out of the closet and you're starting to use that a little bit more around the house than you used to. It might be time for like a strength assessment, a balance assessment, make a plan to prevent a fall before it occurs. Also, training about how to get up from a fall is really important. Someone's ability to do what we call a floor transfer, getting down and up from the floor, can be really important to their just overall quality of life. Responding to a fall, as long as there's no serious injury, that might prevent a call to 911 and getting the EMTs out there. And that actually is kind of a good test of what you're able to do. Is, are you strong enough to get into some of those positions? There might be other medical conditions that limit that, as far as like amputation or pain or things like that. So a physical therapist can help train you while keeping those other conditions in mind. But again, don't wait till you have a fall. If you kind of notice some of these changes, that's the time to seek out some help. The next one is scoliosis, which there's definitely more research for children with scoliosis, but I have worked with a lot of people with adult onset scoliosis for different reasons. Sometimes it's related to a neurological condition they have, like multiple sclerosis, and some of the weakness about the spinal muscles ends up putting them in a scoliosis curve position. So the key things here are postural exercises, even kind of asymmetrical exercise, maybe stretching one side but strengthening and focusing on the other side to kind of purposely, help support the spine in that way. Breathing exercises, risk of pneumonia is really high if you have a significant scoliosis, just because of the way the diaphragm and the spine, and especially if you have a kyphosis on top of it, like kind of that hunchback posture too. So this can be an important part of your care, is learning about breathing exercises and what can be helpful to make that capacity as high as possible to prevent infection or improve your ability to recover, and just general breathing and exercise and activity tolerance as well. The next one is osteoporosis, which might be something that you don't think about as well. We might think about physical therapy after a fracture, which of course is a role that I've played many a times in people's care. But there's also a lot of evidence about weight bearing exercises and also impact exercise for osteoporosis. There was an article I found that I'll link to, talking about impact exercise with resistance training is the best choice to preserve or improve bone mineral density in pre and postmenopausal women. There was also some of the study talking about whole body vibration exercises having no beneficial effect. So just thinking about the impact exercises, weight bearing, resistance training, using weights, using resistance, using bands, things, depending on your level of ability, to work on your bone density and prevent a big incident like a fall with a fracture, as this lovely little graphic shows. And back to falls prevention, if you don't fall and have that hip fracture, you're going to be in a lot better place. And again, the falls training, there's ways to kind of position yourself if you have control while you fall and kind of in protective manners. So that's a big part of it as well. And also disease education. Pretty much all of these, I've said something about disease education. People understanding their condition helps to feel like you're more a part of your care plan, you're more a part of being able to do something about it rather than feeling like this disease is happening to you and you can't do anything. So, kind of that empowering side of things with the education. Osteoarthritis. This kind of links into my recent post about physical therapy is a treatment rather than like a speed bump on the way to treatment. So I'll put the link to that as well. But just, you think about osteoarthritis, we think about knee replacements, hip replacements, etc. That might be the first thing you think of. Joint pain, it's never going to get better. Things like that get thrown out there, especially when people hear the words bone on bone and sounds very severe. But there's a huge role for physical therapy. There's tons of evidence behind it. And working on pain management, strengthening, improving movement quality. So, that gait assessment where we look at how you're walking, look at ways we can improve that, strengthening muscles to help, recover and compensate for the pain you're having. And make sure you're not making a lot of like postural changes that are going to have long-term implications as well. And habit changes, maybe there's a certain time of day where things are better tolerated, using like ice or heat or other modalities that are not narcotic pain management or other prescription type management. That can also help as well. So, physical therapists play a huge role in osteoarthritis, and it doesn't necessarily mean you're going to end up with a joint replacement because there's a lot you can do. So, check out that other article as well about it. And this one's kind of, personal to me because I actually went to physical therapy in college for TMJ, which is your temporomandibular joint, which is your jaw. And so, clenching your teeth at night or even some of the foods that you eat, like or chewing gum a lot, can contribute to pain in that joint. And it was pretty interesting, some of the things that I learned as a patient. And then also, I went to go on to further education at a weekend with a bunch of dentists. And then a physical therapist was teaching it about ways to assess the joint and to help people with joint pain. A lot of it also has to do with your neck posture, which was really interesting to learn. But then also those habit changes. So when I went to physical therapy for this, he recommended like a soft diet for a few weeks while we really tried to calm down the inflammation and the pain. So modifying that in the short term to get these longer term benefits. And then also I ended up getting like a guard that was actually fitted to me, through an orthodontist and things like that. So having someone that's able to assess those things, a specialist in this or who has further training like I do, you can even do internal mouth massage, which sounds super weird, but it's actually really beneficial to get at some of those muscles if they're the ones that are causing a lot of the pain and inflammation that is impacting you. And again, the postural side of things, posture training, strengthening your back muscles to help you not have that neck and upper back posture that can put further strain on the jaw. So yeah, just kind of an interesting one that people might not think about. You might think, oh, I need to talk to my dentist about it, or oh, I just need a massage, which, massage has a role, but if you're not changing, how you're sitting at your desk for 8 hours a day, you might not see the outcome that you want to see. And then I want to revisit these two slides that I visited in the first part. And in case you missed that, this is kind of the same idea. So, the physical therapists play a role as lifestyle modification coaches. So, we have education about movement, biomechanics, full anatomy. We have hands on skills for assessing and treatment through manual therapy, different techniques. And then also just this desire to help people improve their quality of life. I mean, that's what I got into physical therapy for, was a non-invasive method with a lot of knowledge behind it and a lot of research behind it, showing that you can make changes to how you're feeling, pain management, etc. And, the habit changes are key. So, learning more about your condition, that's why I've mentioned it with almost every single one of these, that disease education is a huge part of my treatment, a huge part of other physical therapists' treatment, because, we want you to know what's affecting you, how the disease process works, and what to expect as you get better, or if things decline, or what, a temporary decline looks like, and how we can work our way back out of that and back to an improved quality of life. And think about, the 24 hours a day, 7 days a week. That's what you're living with, the pain you're having or the condition you're dealing with. And we're coming in as a physical therapist, maybe 2 1-hour visits a week, is kind of an average, to 45-minute visits a week, whatever the case may be. And, what changes can we make in that time? So really the bang for your buck is the education, giving you things you can do on your own or with a caregiver or a family member to make these changes last. And then again, just every chronic condition benefits from exercise. There is really not a single condition. You can't look up, physical therapy, resistance exercise, and find evidence that says that, that makes it worse. Like, exercise is so impactful. It's a way to get your blood flowing. It helps with endorphins, it helps with mood, helps with energy, helps improve quality of sleep, et cetera, et cetera. So there's just, so many benefits to learning about exercise, learning about how to personalize your exercise plan, and start implementing some of these helpful changes to your lifestyle. So, ways that you can find a physical therapist, do local research, looking up clinics in your town. You can find a specialist in an area if you feel like you really need someone that knows more than just kind of an average therapist that might not advertise that they know about that condition. There's a few websites for that. There's one called Find a PT. And there's, I think, even like a pelvic health one on the APTA, American Physical Therapy Association. So that's a little bit limited just because you have to be an APTA member. And I know a lot of physical therapists are not. So just kind of looking locally might be the best place to start. And then using that first visit or even that first phone call to the clinic to ask some of your important questions. Does this clinic treat a lot of older adults? Does this clinic treat a lot of people with, whatever condition it may be? If they're totally focused on high school athletes and you're trying to come in there with, COPD and get a really good plan of care, that might not be the best fit. So, knowing where you're going and knowing that you can ask those questions ahead of time. Also, just arriving and thinking about, when you start physical therapy, it is a commitment on your side as well. You're helping to create these goals, you're helping to agree to this plan of care, and the therapist wants you to state your goals. I mean, I have so many times where I've gone to someone's house and it's like, oh, yeah, I just got referred from the hospital that I need home health. And I say, okay, well, what's your goal? And, they don't have really anything in mind. So sometimes we end up talking through it, or they say things like, oh, it's hard to get out of this chair. And I say, okay, well, is that something we want to work on getting better at? And then we can kind of draw from the conversation we have and go from there. But I think if you walk in and say, hey, this is important to me, this is important to my quality of life, I need to be able to do XYZ, that really starts a good productive conversation and might get your therapist on board to understand you better a little bit quicker. And then again, just open communication. If they say, hey, I've got this plan of care and I want to see you 3 times a week and all this, and you just say, I'm a caregiver, or I have all these other commitments, or whatever else the case may be, it would be better to just say that outright instead of, canceling visits or feeling like they're expecting too much. So just being open to having those conversations, expressing the things that you need and what you think you're both going to get out of this. And that's going to help you be successful. So I hope you found both parts of this helpful. And I hope you learned something about physical therapists and the things they can treat, and just kind of the methodology behind it and why we're in a place to treat these conditions and work towards goals. So, any questions, let me know. Thanks.